delivery of our country. And when cancer starts, it takes about 10 years from the seed is sown till it becomes a full-fledged cancer. You got 10 years of time where you can detect this problem. If these ASHA workers are taught how to detect cancer at an early stage, because in our country, nearly 40% of the cancers are head and neck cancers, which is obvious, which can see it. So there are many, many things what we can do with them, and these are a very, very important components of healthcare delivery in a country like ours, where distribution of healthcare specialists is very uneven.
And as you say, early diagnosis means that the whole cost of healthcare comes down.
It's Kiran, if you diagnose cancer at an early stage with a few thousand rupees, you can cure them. You diagnose cancer at an end stage, even after spending few $1 million, you can't save the life.
If we want to bring about a change and reinvent our healthcare system, we need to look at containing the disease at the root. Early diagnosis in healthcare can go a long way in cutting costs, and technology can be the biggest driver in shaping early healthcare delivery. Devi Shetty, a pioneer in using telemedicine in treating patients in remote places, underlines its importance.
You have been someone who's very passionate about using technology, telemedicine, in again, making sure that you connect rural India with the urban infrastructure that we have. And again, that's something, I'd like you to share with the viewers.
Kiran, there are 5 countries in the world which has the capability to put the satellite on the space. And we are one of those countries. We have the privilege of having that knowledge. We get the satellite connection from Indian Space Research Organization. It's called ISRO, free of cost. We are now connected to over few hundred centers in India, and also now we are connected to 56 cities in Africa. In difficult terrains where there is no landline, satellite is the best and the most economic way of communication. Because for the satellite, Kiran, satellite is distance insensitive and it is one-time investment. Using the telemedicine, we have treated over 53,000 heart patients in the last 8 years. It is the largest experience in the world in using satellite for treating heart patients. The beauty of telemedicine, Kiran, is when you hear somebody is unwell, there is 99% possibility that the person who's unwell does not require operation. He requires a medical treatment. Only 1% of the people who are unwell will require operation. That means, technically speaking, you can treat 99% of the patients through the satellite, because you can talk to the patient with a good quality video conferencing. All the images can be transferred. You can see the images. All the blood test reports can be transferred. So, in simple terms, a diabetologist sitting in Narayana Hrudayalaya Telemedicine Center can treat all the diabetes patients in Africa with the satellite link up, because diabetologist doesn't do a procedure. He talks to the patient, he looks at the blood test, and he will advise the patient about the insulin or whatever treatment what is required. This is going to radically transform the way the healthcare is delivered. It is a matter of time, Kiran. Every general practitioner in our country will have a small video conference equipment linked by a mobile phone. If he identifies a patient with the diabetes, he will ask the patient to wait for a minute. He will connect him to the best diabetologist in town, and the consultation happens. If the GP sees someone with kidney failure, he will get the best nephrologist on the other end, and they can talk. Why should a patient travel all the distance and come to the city?
But then again, that tells you the power of technology, because you need to have mobile electronic health records.
Yes,
right?
Exactly.
I think that's also going to be a very important part of our health ecosystem.
Exactly.
So if we want a health system that's effective, optimal, cost-effective, affordable, I think we need to use technology in the best possible way, starting with that whole database that we are going to create using electronic health records, which can be accessible from anywhere, and wherever the patient is.
Yes.
So the mobility of the patient, and yet we need to ensure privacy of the patient.
Yeah. Yes.
All this can be done.
Yes.
Yeah.
Kiran, the technology is pursued by everyone as a tool of the rich people. using technology, rich people will have what they always had in a better shape. But poor people are going to have something with the technology, what they can never dream of having.
Exactly.
Today, somebody having a heart attack in Tripura, in 5 minutes, he can see me, he can talk to me, I can interact with the family members, I can give the instruction to the doctor, an ordinary MBBS doctor, how to deal with the heart attack. So technology is going to change the way everything what we do, especially for the working class and poor, because they don't have the means to travel. And about the other power of UID, Kiran, what will happen today is that once individual has a unique identification number, this is the single source of the largest insurance program in the world. When you are selling a health insurance for the poor people, unlike other insurance programs, you cannot collect the money in advance from them because villages get money 3 times in a year.
Correct.
So essentially, once they have a number, they can keep on paying their insurance premium in installments. So over a period of 1 year, he would have paid the next year's premium. And because the mechanism will allow them to charge their card whenever they have, maybe with 2 rupees or 5 rupees whenever they have, in a kiosk or in a post office or any of the Kirana shops.
No, I never thought of that, yes.
It is going to make a huge difference.
So the government's unique identification program will empower the millions of Indians without any form of insurance and bring them closer to quality medical care. AADHAAR, or the government's identification program, can open up new opportunities for the healthcare system, where giving a simple identity could connect the poor with a public health system or even health insurance. According to Dr. Devi Shetty, in AADHAAR lies one of the prescriptions for success of our healthcare system.
You know, everyone's thinking about the unique identification number, the whole AADHAAR program,
Yes.
to really just look at electronic health records. But what you're saying is it can even enable the whole insurance database. And then you can connect the insurance database with the electronic health records. You can actually create these powerful databases that can talk to each other and from which you can mine very, very valuable data about what the disease mapping of your country is, what resources need to be committed to manage all these diseases. You can actually track patients. You can do wonderful things using all this technology.
Kiran, 3 years from now, when you analyze UID, what it has done to the society, I will take a bet that more than 50% of the UID functions will be around healthcare. Because society doesn't understand how big the healthcare industry is. Global healthcare and wellness industry is a $4.5 trillion industry. US healthcare is $2.5 trillion. And Indian economy is $1 trillion. So I want you to understand that it is a huge, huge industry. It is in a very infantile stage in our country. When this industry wakes up, which has to, because if this industry doesn't wake up, the people are going to suffer. And politicians have realized the power. And more than anything else, Kiran, for a country like ours, which produces 28 million babies a year, we need to create employment opportunities. And today, no industry can create as many jobs as healthcare industry. You look at all the complaints from NHS in England. People do complain that NHS, we are spending so billions of pounds, outcome is not good, there is a waiting list. But they don't realize if NHS closes today, more than people dying because of lack of healthcare, half the British household will lose the job. We grossly underestimate the power of healthcare.
I mean, health is wealth is such an important line in every possible way. It's an all-pervading line. But I think another aspect, I'm going to really sort of, talk about a very important challenge that India has, and that is, we have these very serious problems, the Naxalites, the Maoist problems, a lot of it coming from this whole lack of inclusiveness in what we are doing. Where can the healthcare system play an important role in this inclusiveness?
Kiran, we have a great opportunity to address this problem of social unrest. Like today, 150 districts are virtually controlled by the Naxalites. These 140 or 150 districts have 140 or 150 district headquarters hospitals with 300 to 500 beds. All they have to do is to declare that these hospitals will be made as medical colleges. Once you start a medical college, along with that a nursing and a dental college, in about 3 years, you will have about 5,000 to 8,000 people living in that district, young and restless people, and all it requires is an investment of 50 crore rupees. Now, one of the important jobs we have taken in the Medical Council of India is to encourage all the state governments to start medical colleges. We need to start 100 medical colleges a year for the next 5 years. If we do that, by year 2025, we will have enough number of doctors.
But this is really true out-of-box thinking, because I think these are the kind of innovative concepts and thought processes that we need to engage in and you know, discuss and really drive if we are to solve all these various challenges that we have. Yes. Devi, this has been a fascinating discussion, and thank you so much for, you know, making it so interesting.
Thank you very much, Kiran. Thanks a lot for the opportunity.